Welcome back to part two of Rethinking ADHD. Richard, it's good to see you again.
Yeah, I'm glad we're doing this part two.
Yeah.
This has been a refreshing new look at ADHD, and I'll talk about why I like this part as we go through it.
Yeah, I do too. I think it's really good information and not necessarily information that is talked about all that much because,
Mhm.
still in the, most professionals, most of us talk about ADHD in the same way that we have for 20 years. And we really, and even medication, we talk about all of those things in the same way we have for decades. And yeah, some of the ongoing research in part one, we talked about the multimodal treatment of ADHD study, the MTA study that was done
Mhm.
by a group of researchers starting in the 90s, and some of that preliminary data from the late 90s sort of spurred or triggered this explosion of diagnosis, diagnosing ADHD, treating ADHD. We have a ton of medications, 30 some odd, 36 medications or so for ADHD, and
Mhm.
as we ended the podcast last time, we talked about how 12% of kids or so are diagnosed with ADHD.
Yeah, it's an incredibly large number, which is triple, quadruple, but
Right.
just in 20 or 30 years.
Right.
So yeah, we're going back to, you talked about how we were trained, and we were all trained sort of in the same way because
Mhm.
much of the research that we used to understand ADHD and to treat ADHD came from a um, batch of research that started in the early 90s, late 80s, early 90s. And the most influential, one of the most influential research groups was the multimodal um, treatment approach for ADHD, which was this large study that was at six different places in the country, hundreds of kids. And essentially, what they did is they had four groups. They divided the children into four groups. The children were between ages 7 and 9, so elementary age kids. And they divided them into four groups. They gave one group Ritalin, they gave one group behavior training, they gave a third group a combination of medication and training, and the last group got no treatment. And
Mhm.
I remember being taught that the best treatment for ADHD was a combination of
Absolutely.
medication and behavior training. Okay.
Yeah.
We were all taught that. I mean,
Mhm.
these guys taught us and we taught our students. So we all sort of grew up um, learning about and teaching
Mhm.
about the research that was coming out of these various centers.
Yeah.
And the preliminary results of their study, so from 1990 through the 90s, and you and I were in graduate school in the 90s, and we can recall being taught this stuff as students.
Right.
Preliminary results of all these studies that were undertaken suggested that ADHD was a brain-based disorder, that you sort of were born with it. You didn't get it at 15 or you didn't get it in adulthood. You were born with it, and that it could be treated successfully with stimulant medications. Okay,
Right.
so we all cut our teeth on those two assumptions.
Yeah, I remember we've a psychiatrist that I worked with early in my training, and he actually had trained with Anna Freud, so he had been around for a long time. But I remember when he would do ADHD evaluations, he would ask the mother about prenatal movement. He would ask about how much the baby moved while during pregnancy, because he
Mhm.
believed that, again, that ADHD was this biological thing that was present from the beginning, and
Mhm.
that kids with ADHD, they had that hyperkinetic tendency even in utero. Uh,
Mhm.
so. But as those researchers that did the MTA study, as they continued to collect their data, remember you were very specific to say preliminary data that came out in the late 90s suggested this. As they continued to collect data over time, a different picture started to emerge.
Right.
And I think it's important to throw in here that this is what science does, right? Science
Mhm.
collects some information. They let us know what that information says, but then they continue to collect information over time to confirm, to support, or refute the results of the preliminary or earlier data. That's what science does. And,
Right.
and so I think it's great that we have some of this additional research. I don't think the research is quite as public or quite as available out there as some of that preliminary data was, but
Mhm.
but it's great that it's out there so that we can continue to refine the way that we think about ADHD or whatever we're studying.
Right. We happen to be, you mentioned science. We happen to be living in a time where science is not respected, where
Right.
it's criticized, not valued. And yet, this is a good example of good science. You set up a good study, a study that provides useful information, and you keep studying the question, and suddenly a different picture emerges.
Mhm.
And that's what science does, is it should, carefully designed research studies should force us to continue to question our beliefs and our practices.
Right.
And that's exactly what happened with this study. And that's why we have to be very careful about giving the science the respect that it's due. These are dedicated people doing very valuable work.
Right.
And
Yeah,
uh,
'cause I think it's really easy to say, when the revision of the information comes out. So just kind of jumping to some of the results of this, how things have emerged over time, as I make this point. We talked about how after 14 months of treatment with ADHD,
right.
with some of these medications and stuff, the ADHD symptoms significantly reduced. And because of that, it sent this shockwave of through the field to where tons of kids were being identified with ADHD and lots of prescriptions were being written
Mhm.
for stimulant medications. Over time, what they found is that so that was at 14 months. After 36 months, so 3 years, if a kid has been on ADHD medication for 3 years, what the research started to find is that those taking medication, their symptoms were about the same as those who didn't take medication.
Mhm. Mhm.
So while there was this initial benefit of the medication, over time, some of those symptoms reemerged and began to be present again. And
There
I think
are
that what people do is they see this revision of the data come out and they say, oh, well, see, science was wrong because it said that at 14 months that it was better, but it's not really better. And so science is bad. Science doesn't really help us. But again, I think that this is really critical, important information that, in the short term, the medication may be helpful, but in the long term, maybe it's not as helpful.
there are very few sentences that I've read in my entire career that stopped me dead in my tracks.
Mhm.
When I read this, that said that after 36 months, those taking medications had the same symptoms. And that was stunning. I mean, I was absolutely, because I've been talking about these medications for 40 years. And all of a sudden, you have to completely recalibrate a belief system that I've held for probably half a century.
Mhm.
And it was a stunning reminder that science proceeds, it progresses, and it provides us, you know, the 14-month study was correct then, okay? But as we collected more data, the picture changes, which
Right.
is which is what should happen. Now, after these results came out, Swanson, who was part of the original study and who said the medications are effective after 14 months or up to 14 months, said there are things about the way we do this, and I love the humility here. There are things about the way we do this work that just are definitely wrong. The way we do this work is the way he told us to do it.
Right.
For him, to stand up at the end of his career and say, I think we might have made some mistakes,
Mhm.
takes courage, but what a valuable service that he's done. Now, there's a guy in Britain, he teaches at King's College. He's of another generation, newer generation, who said, we have a clinical definition of ADHD, the one that all of us grew up on,
Mhm.
that is increasingly unanchored from what we're finding in our science.
Mhm.
Again, the science is telling a different story, and we have to listen to it.
Right. And so as folks who listen to the podcast regularly remember from a couple of weeks ago when we talked about depression,
Exactly.
we talked about the difference between that there may be a difference between ADHD. At that time we talked about the difference between depression,
Right.
biological depression, and depressive symptoms. Um,
Right.
and we may be talking about the same thing here, that there may be, we really have to ask questions about whether ADHD is a medical diagnosis that requires a medical solution, i.e.,
Right.
medication,
Mhm.
or is this caused by something else? Is it brain-based or is it life-based?
Right.
And again, it's the same conversation we had about depression a couple of weeks ago. And it is really important that we have these conversations because, um, you know, Richard, you and I have been critical of some of these things in the past.
Mhm.
I haven't quite articulated it this way because we didn't see some of this research from like the MTA study and some other studies that have been ongoing, looking at the long-term benefits of medication, some of these medications. But I think it's a really important question to ask and an important thing to look at as to whether or not it really is a brain-based condition or is it something that is just based upon the life situation that a person finds himself in.
Right, because that's what we've been doing. That's what we've been saying. This is a brain-based disorder. Here are the MRI scans. Here's the electrophysiology. Here are the blood flow studies. So no matter how we study the brain, we keep seeing these differences. And so we make these assumptions that it is a brain-based disorder that can be fixed, and we can fix the brain by giving these medications. And
Mhm.
that it's based on those assumptions that we've been practicing in this arena of ADHD since 1990, essentially. So it was a 20, 30 some years. Okay. So I think the next step, therefore, is to question the assumptions.
Right.
Okay. And I think that's what we are as research. You and I don't do a lot of original research now. We do explanatory, we do
Translational.
translational research. We take the research and translate it, but we're researchers and clinicians, and it is our obligation as clinicians to keep up with this research to make sure that we're practicing good science.
Absolutely. So when it comes to thinking about ADHD as a medical diagnosis, there's another researcher named Russell Barkley who's been around forever.
He's an acknowledged expert. I mean,
But
no question.
and he has referred to ADHD as akin to diabetes of the brain, right?
Right.
He says that either you have it or you don't have it.
Mhm.
And now some of the research is saying that, well, it could be something in the brain or it could be something in the environment.
Mhm.
Even Barkley acknowledges that, only say only is a pretty decent percentage. About 75% of people with ADHD respond positively to medication.
Right. And we've known that for many, many, many years. I mean, we've been
Right,
saying that since the late 80s and early 90s.
right,
Not everybody responds to medication. We've never understood, we don't really know why,
right,
but we all say that. I mean, we
right.
know that 25% don't respond.
Right. And so what about that 25%? Who are
Right.
they? And what about the 75% that respond to medication but may have some comorbidities? They may also have anxiety. About a third of kids with ADHD also have anxiety, and about a third of kids with ADHD also have depression.
Mhm.
And well, we could get into oppositional defiant disorder because we're getting close to about half of kids with ADHD have oppositional defiant disorder. But as we look at some of these conditions and some of these kids with ADHD, it's not like we have um, pure samples where you can take a person, you can take a large group of people and you say, these kids purely have ADHD That's all they have. Their environments are perfect.
Mhm.
Their life situations are perfect. They don't have anything else complicating it. They just have ADHD. So let's research and study them.
Right.
We don't really have that because that's
These are not
real life.
laboratory animals.
Right.
We
We don't
can't,
have that much control.
right. We can't experiment on people and create genetically pure ADHD subjects. Okay. They're people with multiple factors. Now, the important thing though is that we use the Diagnostic and Statistical Manual
Hmm.
and we say, okay, if you have this, and this, you meet criteria for the diagnosis.
Hmm.
In that regard, Barclay's right. You have it or you don't. Okay. But unlike diabetes, there is no lab test.
Right.
Okay. So it's somebody's judgment. I think you meet criteria. So I'm going to say, yes, you have ADHD.
Hmm.
But we all know that some kids have a lot of ADHD. And I mean, there is absolutely no question that something is amiss.
Right.
And other kids sort of have some symptoms, but it's really not a huge issue. Okay. So we've known that clinically from the beginning.
Right.
Okay. So on the one hand, we make an either or diagnosis. You either have it or you don't.
Right.
Okay. Dichotomy. But we also know that even if you have the diagnosis, 25% don't respond to medication.
Right.
So why don't they? If you have this disorder, why don't you respond? Because
Right.
if you have diabetes, you're going to respond.
Right. And I think it's important, maybe this is the place to throw this issue in here that you and I have you and I've talked about for a long time before we even started doing a podcast. And that is, there are situations if we look at the time frame in which we're talking about, again, so many times when we talk about how things have changed over time, we're really focusing on just one piece.
Mhm.
So we've been talking about ADHD, and we talked about ADHD over the past, number
Mhm.
of decades and how it's evolved. But as we look at the time frame in which, some of these changes happened, and the significant increase in the number of diagnoses, the number of medications, the number of prescriptions that are written, as we look at those and we look at what else was happening at that same time, let's not forget that in the early 2000s, and we're talking about children, so we're not even talking about adults yet. We're talking about children. At the same time, I mentioned earlier in the previous podcast that most of the time ADHD is diagnosed in second, third, fourth grade. What
Mhm.
else is happening in second, third, and fourth grade?
Right.
Well, in the early 2000s, we have No Child Left Behind, and we have the introduction of high stakes testing. And while that puts a lot of pressure on the kids, it also puts a lot of pressure on the teachers.
Right.
And so at that point, and starting in the early 2000s, we have seen a significant change in the way states, not the federal Department of Education, which is to be clear, state departments of education have been managing school curricula. And what we've seen is that, and any parent can attest to this, what used to be done in like first or second grade is now being done in kindergarten.
Mhm.
That started in the early 2000s, early to mid 2000s. And so the curriculum has been pushed down to where younger and younger kids are expected to do higher and higher levels of schooling. So it got to the point, and Richard, I know that you remember this, in the mid 2000s, we would do evaluations for kids who were not doing well in class. We would do nationally based standardized testing on them, and they were doing just fine on the national based testing, but they were failing in class.
Right.
That's because they had the skills that were appropriate for that age and that grade level, but the
Right.
curriculum that they were using was at a higher level, and they just weren't able to do that higher level. So they
Right.
looked like they were performing poorly, and they were maybe learning disabled. But what was really a problem is what we referred to at the time as curriculum disabled. They were just not able to manage that curriculum. And so while all of this is happening, we also see this significant increase in ADHD.
Right.
Okay, what is one of the primary sources of report for ADHD symptoms? The classroom. So
Right.
if a kid who may be typically developing is in a classroom where the expectations are significantly higher, where the demands are significantly higher, and the kids are expected to stay in their seat and do higher and higher levels of
Right.
and more challenging of work, those kids who are perfectly typical, but just not able to do the higher level of work, those kids are going to look disabled. They're going to look disordered. They're going to look as though they can't focus and attend. Um, and so, is that one of the things that's contributing so that they look like they have ADHD? Because, as Barkley said, they either have it or they don't. They meet the criteria based on the DSM, but it's not because that they have a biological basis of ADHD. They have an environmental basis of ADHD.
That's what we mean by a faulty environment.
Right.
Curriculum is inappropriate. Mhm.
Yeah. So we have to take some of that into consideration, and perhaps
Mhm.
that is what accounts for the significantly higher level, higher prevalence rate of ADHD, and why the medication isn't working the way that we would anticipate it working.
Mhm.
That, those kids who don't really have ADHD, yeah, they may have seen some initial improvement, because let's be honest, anybody who takes a stimulant medication for a period of time, you're going to see some improved concentration and focus because
Right.
that's what stimulants do.
What it does, right. Mhm.
But but over time, it's not going to continue to be effective because there's not really something that's brain based. It's an
Mhm.
environmental issue.
Right. Right. And so we know too that we have never been able to we haven't found any biological markers for ADHD.
Right.
We've done all kinds of studies, and in large groups there seem to be some differences, but there is no X-ray, MRI, PET scan that will say this child has ADHD because of this brain marker. There are no brain markers. Okay. So that's one issue. Is it brain-based? And we assume that it is, but we may not, we're no longer certain that it is. Okay. So the second question is, what about medications?
Right.
Well, because as we've been saying, by 36 months, the kids on medication had the same symptoms as kids who were not on medication. Okay, so everybody was the same after 3 years.
Hmm.
So there is a strong, and this is important. There is a strong medication effect on behavior. These medications do have a strong effect on behavior, but very little on academic achievement.
Right.
And there have been enough studies now that show that behavior improves, but learning does not.
Hmm.
So yes, and some of the most fascinating research has been done with high school and college students who can report on the findings and articulate what's happening. And they will say things like, I could do more problems. My favorite is I could sit and study now that I'm on medication, but I didn't learn that much more.
Right.
Okay. What it did is it allowed me to tolerate boredom.
Hmm.
I wasn't jumping around and moving around. I could tolerate boredom, but I wasn't really learning a significant amount more. And the studies that are done, the more careful studies are kids will do more problems, but their test scores don't improve. They
Right.
can tolerate the work, but they're nearly not learning that. So the medication keeps you in your seat.
Hmm.
It may not be having a direct effect on cognitive functions.
Yeah, and some of that is stuff that we have talked about for some time. And again, I know that you and I have we talk about this with people a lot. ADHD medication, Ritalin, Adderall, Poco, we can just name all of them.
Um,
It doesn't it doesn't teach skills. You know,
right.
just because you take a stimulant medication doesn't automatically make you organized,
Hmm.
which is a significant symptom associated with ADHD is disorganization. Taking medication doesn't make you automatically make you organized. You still have to learn that skill. Um, you know,
Right.
I've mentioned before that I have ADHD and I take medication, and I think that you can attest to I happen to be one where my medication continues to be helpful. That there is a difference when I take my medication versus when I do not take my medication. And I can tell in my work if there's a day when I forget to take my medication versus when I don't. Um, when I started taking my medication, I still had to learn how to learn. I had
Hmm.
to learn how to study and how to sit so that I could write because while I could focus and yeah, I can read the articles and I could read, do the things I needed to do, I didn't necessarily have the skill to organize my thoughts so that I could make them coherent and
Hmm.
meaning. I
Right.
still had to learn that skill. And a lot of times, and I think that that's where we had that, it was so enforced and reinforced with us that combination of medication and behavioral treatment is so important because
Right.
the medication makes you available to learn the skills.
Right.
As research continues, hopefully we will learn more and more about the benefit of that combination of treatment. But we really have to attend to the fact that medication in and of itself isn't necessarily going to be the cure-all that we once thought that it would be.
That's right. And when you do these SAT class preparation classes, or you do study groups, or you do, yeah, you can tolerate things that aren't interesting. You can tolerate boredom, but you may not be learning anything more.
Hmm.
Okay. And so I think we need to be careful. In some individuals, it helps. It really does help because if you can stay in your seat, chances are you're going to be able to focus and you'll learn something. But I think you have to monitor that in individual cases.
Right.
It may or may not make a difference. But I think that yes, it will make it easier to tolerate staying in your seat, dealing with boredom, dealing with things you're not interested in, but it may not translate into improved academic performance.
Absolutely.
In fact, Swanson says the only long-term effect of Ritalin is suppression of growth, because apparently there is some pretty significant and reliable research that says that it does inhibit growth, and you could end up about an inch shorter than you should have been if you're on the medication. Now, this is during childhood. If you go on as an adult, your growth is over, so it doesn't matter, but it would
Hmm.
matter for children. Now, when you hear all this stuff, you begin to say, well, maybe all those critics who say ADHD isn't real and medication is just poison and we shouldn't be drugging our kids. And does this mean they're right? No, I don't. They're not right. There's too much research. There's too much good research to suggest that this is a real diagnosis.
Hmm.
It has also existed for thousands of years. This isn't because of Mario Brothers or Minecraft or video games. ADHD has been with us probably since the beginning of time. It
Hmm.
certainly has been with us since the beginning of writing because we have ancient Greek texts 2,000 years old that describe kids with this disorder.
Hmm.
What we do know is this, and I think these points are worth making. It is neurodevelopmental in some individuals. It just isn't neurodevelopmental in all individuals.
Right.
Okay.
Yeah, and I think that that highlights in the critical point of making sure that a good diagnostic evaluation is done.
Mm,
Because we have to find ways to differentiate what really is ADHD versus what is sort of environmentally uh,
right.
caused symptoms that look like ADHD.
And we need to look at all those factors.
Right.
Okay. Second, I think ADHD is probably on a continuum the way autism is on a continuum. I think some kids have very severe symptoms, some kids have very mild symptoms.
Mm-hmm.
It's not an either or. It's probably somewhere you're somewhere on a continuum.
Yeah, it is
Um,
definitely a heterogeneous group.
mhm,
We know that they are very different. Each kid with ADHD looks different.
right. And here's the other thing, and this is really tricky. It could just be your personality. There are people who have a sparkling personality. I have a friend, she just sparkles when she enters a room. She doesn't have ADHD. It's just her personality.
Hmm.
Okay. It's not a disorder. You don't have a disorder. You have a certain kind of personality. Some people are very quiet, calm. reserved, withdrawn, inhibited. Some people are very effusive, ebullient, and expressive. So it might just be your personality. And many times parents come in and say, I think it's just his personality.
Right.
It might, you might be absolutely right.
Right.
And we have to sort that out very carefully.
Yeah. And again, the therapeutic effects of medication are going to vary depending
That's
on
right.
um, whether it's really ADHD or it's just ADHD symptoms or where on that continuum one falls. And there are other researchers out there like Dr. Daniel Amen who talks about maybe there are more subtypes of ADHD than what we've been talking about, more than just the inattentive, hyperactive, or combined types. There are these other subtypes that we need to be paying attention to as well.
Right. Mhm.
I think there's a lot of stuff that we still have to keep looking at.
That's right. Because stimulant medication may not be a solution for all of these,
Right,
what may not be a medical problem. Okay. We have assumed for many years, many decades, that ADHD is a medical problem and there is a medical solution. I don't think we can proceed on that basis any longer. I think it requires that we take a fresh look at ADHD and recognize how complex it really is.
right,
Why some children respond, some don't. Why there are subtypes beyond the three that are in, we have three types of ADHD. There are probably many more than that, that we
right.
have to come to terms with. The other thing is that for many people, stimulant medication may have a placebo effect, just the way antidepressants have a placebo effect. If you
Mhm.
think you're getting better, you're going to do better.
Right. Yeah,
Okay. So I think
absolutely.
I think we need to pause and rethink. I certainly am going to rethink how I deal with and think about ADHD based on this new information.
Right. And again, it's important that, if you think that ADHD is a concern, that you get a thorough, evaluation to make sure that you're really looking at what really is ADHD, or is it just
Right.
a reflection of what's happening in the environment? So
Exactly.
again, we will continue to have conversations about this moving forward. So, but that's it for today. So until next time, stay happy, stay healthy, and forget to be afraid.